Hi, I am Dr. Saroj from King's Hospital, Bhubaneswar. Today we are going to discuss some of the important facts about inflammatory bowel disease. Inflammatory bowel disease are chronic inflammatory conditions of the gastrointestinal tract. There are two types of inflammatory bowel diseases, that is ulcerative colitis and Crohn's disease. Ulcerative colitis usually involves the mucosa and submucosa, mostly involves the large intestine, and the commonest part involved is the rectum, that is the one of the distal parts of the large intestine. Crohn's disease can involve the all parts of the gastrointestinal tract, but usually involves the distal part of the small intestine and proximal part of the large intestine. The commonest presentations of the inflammatory bowel disease are abdominal pain, chronic diarrhea, weight loss, and the extraintestinal manifestations of the inflammatory bowel disease are arthritis, arthralgia, liver diseases like primary sclerosing cholangitis, skin conditions like erythema nodosum, pyoderma gangrenosum. Also, these diseases can present with complications like toxic megacolon, strictures of the small intestine, perianal complications like perianal abscess, perianal fistula. There is a risk of malignancy in both the diseases, but the high risk is with ulcerative colitis, and the treatment for these diseases are lifestyle modifications, dietary modifications, oral and injectable drugs. The newer molecules like biologicals can modify the course of the disease. Surgery is the last resort if patient presented with complications or the disease becomes refractory to medication. And patients usually ignore these symptoms, and they usually visit a doctor after long-term symptoms, or if there is a recurrence of the disease. So don't ignore these symptoms and consult your nearest doctor or a gastroenterologist for your symptoms.